So now I'm going to do the formal welcome. So I'd like to welcome everybody to the Hants and Isle of Wight Social Prescribing Network webinar. And as you are aware, today's theme is mental health support during COVID-19 and beyond. So my name is Angela Gill and I'm facilitating the webinar on behalf of Community First, but also really on behalf of the Hampshire CVS network. I'm going to go through the titles for today. So starting with Tim Houghton and Helen Fisher in a moment, they will be talking through mental health support and initiatives from the community and voluntary sector. So they're going to be setting the scene from the community and voluntary sector. Then my colleague Elizabeth White-Ripley will be covering Hampshire wellbeing services, followed by Jonathan Foley and Amy Francis on working across boundaries. And they're all obviously linked theme with mental health, but they're all really interesting presentations. Jason Hope is then going to talk about No Wrong Door and explain what that is. And last but definitely not least is Mike Newman, who's going to be talking about the mental health and wellbeing resources. At the end of all of the presentations, obviously after each one, there'll be a couple of minutes for questions, as I said. And right at the end, I'll then be confirming the date for the next Hants and Isle of Wight Social Prescribing Network webinar, which, as you can see, will be Wednesday, the 3rd of March, 2021, between 1 and 2. So jot that into your diaries. But I'm also going to give you the whole list for all of 2021. So be ready. That will be right at the end. Okay, so without further ado, I'm going to hand over to Tim Houghton.
Thank you very much, Angela, and good afternoon, everybody. It's fantastic to see some regular attendees again at our social prescribing network, and also some new faces and names. So welcome to everybody. As Angela says, I'm just going to be very, very brief in terms of just setting the scene, really, because we've got some fantastic speakers who are going to go into some more detail about some of the projects and initiatives that they're working on. But I think it'll come as no surprise, and I appreciate in the audience that we've got this afternoon, we're talking primarily to those who already know the extent of mental health needs in our communities. But the scale of the challenge now, given the pandemic that we're in the midst of, and importantly, the lasting legacy of COVID, is going to be significant in terms of its impact on our community's mental health. And we know that's a whole spectrum of needs. We know that from some recent national survey work, and by recent I'm talking in the last week to 10 days, around about 46% of voluntary sector respondents indicated that they had significant unmet mental health needs in their communities. And if you look at the unmet needs now, the two biggest needs, standout needs, are hardship and mental health. And actually, it's often mental health that's the biggest unmet need over and above hardship. So nobody's underestimating the hardship that some places are facing and some people are facing around the basics of food and medicines and other needs that they have. But that mental health need is clearly one of the highest priorities and a difficult one to address in the current circumstances. And it's no surprise to know that obviously mental health and hardship are often going hand in hand, and one causing impact on the other. We know that in Hampshire, the mental health is significantly impacting younger people. We know there's an amazing array of youth organisations that have done brilliantly through the pandemic to try and convert some of their face-to-face interventions, outreach work, youth clubs and other interventions to online activities. We know that schools and education sector have done the same. We've got through the Hampshire Young Carers Alliance, some brilliant work that our young carers partners are doing, again, to get services online and recognising that those who do have caring responsibilities need to look after themselves as well as those that they are caring for. And I'm always amazed by the resilience and ability of young carers to cope and deal with things which are significant challenges to those of us in adult life. Whilst digital support has been really valuable, actually the face-to-face engagement and the lack of that is really starting to impact, and we're seeing some real good hard evidence of that amongst some of our younger people. in our communities, and that's really going to be a legacy that we need to address. We know that mental health is impacting families, particularly those in the sort of working age population, those impacted again by financial hardship, those who have either lost jobs or have faced significant changes in their jobs. They've got threats to jobs, threats to their own businesses. We know that, we've got a whole group of people in our communities who are just about managing, they just about kept their head above water. And actually the challenge there for us in the voluntary sector, and indeed all sectors, is to identify those and to reach out and offer support in a way that's appropriate to their needs. We know there's a significant degree of pride in our lives and in our families, in our communities, and sometimes it's hard for those who aren't used to reaching out to ask for help to do so, and hard for those services to reach into those families and to offer that effective support. We do know that mental health is impacting some of our older residents, and we know that through the work that organisations have done, particularly to identify and address isolation and the impacts of isolation and loneliness. We know that a lot of our projects that are so valuable to keeping older people mentally and physically well include social clubs, include lunch clubs, face-to-face befriending, some of the home help type services. And while some of those, particularly home help, have been able to restart and to continue through COVID, albeit in a skeleton fashion, many of the social engagement activities haven't been able to. And that's just heightened the need for some form of interaction. We know that there's been fantastic telephone befriending, and a number of projects have been able to continue to support older people in their own homes and continue to enable older people to engage in essential services. So things like access to medical appointments and other work that volunteers and groups have been able to do. But it's not the same as being able to go out to those regular activities. So we're going to hear this afternoon about some of the brilliant work that our Mind organisations in Houghton, East Hampshire Mind, in Solent Mind and in Andover Mind have been working on, the support of and interventions from CCG and STP partners, and of course from Hampshire County Council in the work that they're doing. I think it's really important to emphasise that to tackle the mental health problem, we can't just point the finger at one sector. This has got to be a real collaboration between the voluntary community sector and with the public and statutory sectors and our NHS services. We know that there's a lot that the voluntary sector can do around the early intervention, prevention, and tackling the lower level mental health needs and trying to prevent that escalation to more services that are provided through NHS and mental health services and support. But we do need to work quite flexibly and collaboratively. And I think that's part of the purpose of this network, is to bring together partners to try and do that. It's also important, I think, just to end on, to recognise that the part of the determinants of mental health are people's physical activity and health, particularly those with underlying conditions and longer term health needs. And we need to try and do a lot more now to encourage people to rebuild trust in being able to go outdoors, albeit safely and in full compliance with the COVID restrictions as we move from lockdown into our tier 2 at the moment. And I know there's many organisations working on getting sports activities back up and running, getting just activities like our Healthy Walks programs and others things back up and running so that people can do those safely. And I'm delighted to hand over and just welcome Helen Fisher from Energise Me, who I think is just going to say a few words about the programs and support they are involved in and offering by way of introduction. So thank you, everybody, and over to you, Helen.
Thanks very much, Tim. Thanks for that introduction. And obviously, as Tim said, there's obvious links with good mental health and good physical health. At Energise Me, we are the lead organisation in Hampshire and the Isle of Wight for the development of physical activity. I just wanted to highlight 3 opportunities where we're supporting the social prescribing activity across Hampshire and the Isle of Wight. So some of you may be aware that we have free online training for people undertaking social prescribing activity. This is in its broadest sense, so health and wellbeing coaches, social prescribers in different forms. And this will help you to have physical health conversations with patients. So please visit our website where you can find out more information. Our first training is taking place next week, and we've got a few set up over the coming months. So if you haven't heard about it, my colleague Emily will be delighted to hear from you. The second one is in terms of supporting community groups to provide an offer. We've worked with some social prescribers, particularly around the mental health agenda, to support people who have been isolated as a result of COVID, to offer online yoga sessions, which came direct from the participants themselves as something that they wanted. So that's something that we can fund and support social prescribers to work with community organisations locally to do. And thirdly, you will have hopefully received information last week from Lynn around the Thriving Communities programme. This is the National Academy for Social Prescribing's new programme, which we're part of. We're part of the physical activity strand, but it does cut across all different sectors. And it's really exciting to see that cross-sector approach to social prescribing, which I know many social prescribers have welcomed. So please engage with the opportunities there. There's a funding opportunity. There's an opportunity for community groups to be part of a learning group, but there'll be more opportunities coming out of the new year, namely that we've got a post that we'll be working with my colleague Emily to work with community groups to help them develop a physical activity offer that you can prescribe to prescribe your patients to.
Brilliant. Thank you very much indeed, both. So I'm now going to have a little look at the chat. I've got the first question from Francesca Howe, which says, hello, Tim. In reference to your comments about how young carers' mental health is impacted by the COVID pandemic, we have noted that our adult unpaid carers are really suffering. However, the carer cafes and support groups do not seem to be running. Do we know what the main challenges are that they are experiencing, and is there a response to these challenges? So over to you, please, Tim.
So thanks, Angela, and thank you, Francesca. It's a good question, and I'm just scribbling a quick answer to you on the chat as well. But just to say that one of the challenges, there are many, but one of the big ones that we're finding is that actually in order for groups were using a myriad of venues. Many venues are closed and remain closed because it's not economically viable for those venues to reopen where those sorts of facilities like the carers cafes and other things can happen. Now, I know it's got to be treated on a case-by-case basis, and it may be a question of looking at what can be done differently. Are there venues that are open that could cater for a wider range of groups and organisations? But many are finding it really difficult because the COVID restrictions, even as we come out of lockdown and go into tier 2, are quite severe. And unless you can open up wholesale and generate enough income, it's not necessarily worthwhile certain groups going back. And some groups are concerned. Some groups are volunteer led, and volunteers may have stopped volunteering. Even during this very relatively shorter second lockdown, we know there's been a few that have not come back to volunteering. We may have other volunteers as well, so the overall numbers are fairly stable, but some of those who had been volunteering groups before may have stopped. So I think it's probably worth looking if you've got particular examples of groups that haven't been able to go back, and we can see if we can help them and make sure the advice on the interpretation of some of the COVID restrictions is correct. We're not trying to bypass or cut across any of those or take shortcuts. Priority is to keep people safe, but we do need to try and get some of those groups back meeting face to face as soon as we can. We appreciate that.
Brilliant, thank you very much. And also, Amy Francis, if you can see in chat, she's made a comment about iTalk. They've launched a carers session called Self-Care for Carers, which is being developed by Webinar. It's a one-off workshop looking at techniques to manage worries and mental health. The next session's on the 8th of December. And there's again another comment from Gail Tong around A&E and how many, she was concerned how many people were young and old with mental health issues who were at A&E because they need someone to talk to. So that reflects really what Tim was saying about the self-isolation and the elements of COVID-19 and the impact it's had.
And Angela, if I could just very briefly, I know time is the essence in these meetings, but it's an excellent observation, Gail, and we are looking at a range of interventions that we can try and work with. I know in South East Hampshire and Fareham and Gosport are putting resources into something called a high intensity user program to try and tackle unnecessary A&E admissions, or where people are ending up in A&E without recourse to other services. And that's a program that I know that Southern Health and through the Health Connectors and Community First are going to be quite heavily involved in. It's only just about to launch, but through that, what not only are the individual clients we're hoping to pick up, but to identify those unmet needs, such as A&E being a depository for people with mental health needs, and particularly families and young people, and how we can best signpost them to other support and services. So it is something that's on the radar. I don't think that will be the only solution. And again, others around the virtual table this afternoon may have other suggestions or projects or initiatives in your areas that we could start to look at and try and help to tackle that really crucial issue.
Thank you. Okay, I'm going to ask everyone to have a little look at chat, because there's other comments that we won't have time for me to read out. But there's one question for Helen, a very quick question before I move on. Helen, the question is from Heather Massey. She's asked, does Energise Me support community groups to support their offers in Portsmouth as well?
Yes, absolutely. We cover the whole geographical area of Hampshire and the Isle of Wight. And I know my colleague Emily has connected with Heather, so we'll be able to work with Heather.
Okay, that's great. So thank you very much for all the questions via chat. That was great. I'm now going to hand over to Elizabeth White-Ripley. Thank you, Elizabeth.
Thank you, Angela, for that introduction, and also for the invitation to join you at the Hampshire and Isle of Wight Social Prescribing Network webinar focusing on mental health support, and to have the opportunity to tell you all more about the Hampshire wellbeing services. So a little bit of background. Hampshire Wellbeing Services are commissioned by Hampshire County Council and the Hampshire Clinical Commissioning Groups. They've been around since 2012 and were recommissioned in 2017. And since then, all the services have been delivered by the 3 local mind associations in Hampshire. So that's Solent Mind, and we deliver in the New Forest, Eastleigh, Winchester and Fareham and Gosport. Andover Mind, which covers the area of Test Valley, obviously Andover and Romsey, and then North Hampshire, so Basingstoke, Farnborough and up to Aldershot. And then Havant East Hants Mind in the east, Havant, Alton, Petersfield and up to Borden. Probably one important point to make at this point is that the wellbeing services cover the administrative area of Hampshire and not the unitary authorities of Portsmouth and Southampton, which have their own services. So what are the wellbeing services? We tend to talk about them being based on the 5 steps to wellbeing, and that's a term which you may hear mentioned by other presenters today. Founded on the principles that we all have better mental well-being if we connect, if we engage and meet with other people, if we give, if we become involved in the community in which we live, making use of our skills and possibly volunteering, if we notice, if we're aware of the world around us, take notice of small changes in ourselves and our environment. If we're active, there's an awful lot of evidence now that shows that regular physical activity is associated with lower rates of depression and anxiety across all age groups. And the last one there, learn. If we keep learning, it enhances our self-esteem, encourages social interaction. And one of the main things which we do within the wellbeing services is help people to learn coping techniques so that they can better manage their own mental well-being. So what do our services look like? We offer flexible programs, usually up to a maximum of about 6 months duration. And as I say, they're based around courses which help people to gain skills and learn techniques. There's some popular ones there which we offer across the Winchester and Eastleigh service: anxiety management, self-esteem, confidence building, something called the Decider Life Skills, which not everybody may be familiar with. It's 12 skills based on CBT and DBT theories. And that is very much about people learning skills to help themselves, but in a fun way. But these courses, I say, are offered across Eastleigh and Winchester, but similar ones will be offered across all the other services. Alongside those courses, we offer things like mindfulness, relaxation, sometimes yoga, either in courses or one-off workshops. We're encouraging people to be active. So some services have walking groups, running groups, yoga groups, but we're also very much focused on supporting people to engage with what's going on in their local community. So we will be making links into things that are going on, like the local health walks when those are taking place, and the park runs when they're happening again. We also encourage people to connect. So when we are delivering these services face-to-face, people will connect by coming into the centres and meeting in groups. We encourage peer support groups, and those also we want to be outward looking to engage with things that are going on in the community, and particularly with things like singing, creative writing, art activities. One of our kind of founding principles is that we're committed to creating healthy communities where everyone feels valued. So I suppose the important question at this time is, have these services been able to adapt to COVID-19 as it is at the moment and looking forward? And the answer is absolutely yes. So from services which were largely delivered face-to-face in centres across the county, we've transitioned to services which are mainly delivered online via Zoom. We're all maintaining contact with the people who are using our services through phone and by email. And the other question I get asked is, how have people adapted? And I have to say, incredibly well. There was initially some anxiety and some hesitation. So in the early days of the first lockdown, a lot of people would say, no, I'll wait until the centre opens again, until I can actually come in. But that lockdown went on for a long time. And gradually people said, well, perhaps I'll give it a go. And all our staff have been incredibly supportive. They've reassured people. They've done one-to-one coaching sessions before people have joined Zoom courses. And so there's an interesting statistic on there that across Eastleigh and Winchester, of just over 100 people who started their wellbeing programme in the early months of 2020, over 75% of them have now almost completed that programme through Zoom-based courses. So that has been replicated as well across the other services. We haven't forgotten about the 25% who find it more challenging. We have, as local minds, we have had some access to laptops that we've been able to get to some people who haven't had those. But there are other people who have persistently said, no, we can't do this at the present time. So we're keeping in contact with those people. And as soon as we're able to offer more face-to-face groups within the centres or perhaps within community settings, we will be doing that. Probably important just to add that there are some groups, such as the walking groups that have continued to meet in small groups and obviously appropriately socially distanced over the last few few months. So lastly, how can you contact the services? I've put up there the contact details for the 3 Solent Mine services. So that's Eastleigh and Winchester, New Forest and Fareham and Gosport. The best way to contact us at the moment is by email. If you are interested in the services run by Andover Mind and Haven't Mind, just go on their website and their up-to-date contact details will be on there. I probably should say also that the services are for adults, so that's people 18 and above, but there's no upper age limit. And in terms of people under 18, the only ones we can formally take at the moment are those who are transitioning from CAMS, the child and adolescent mental health services, to the adult services. But I think that's all to say at the moment. Thank you very much for listening, and I'd be really happy to answer any questions.
Thank you very much, Elizabeth. So we have a few questions. One, I think you sort of answered quite early on. So one was, I think, from Natasha, which said, are these courses just on Zoom? And the answer was most of them are at the moment. Is that right?
Yes, that's right. They are at the moment, but you know, now we are looking, we're just finishing most of the ones probably in mid-December. So we're now planning for January, and we're hoping then that we'll be able to offer a mixed program of Zoom and hopefully some face-to-face as well.
Brilliant. Thank you very much. That was from Natasha. Emily asked, can people join the active groups without having to go through a program first?
No, when people can either self-refer to us, or if they're under a community mental health team, they need to be referred by that team. We also get referrals from social work teams, supported housing providers, quite an array of organisations. We do an assessment when people first come to us, and we usually find it's most helpful if they do at least one of the kind of skills-based courses, but absolutely one of the more active ones alongside that.
Brilliant. Okay, there's quite a few more questions. I'm only going to have time for one more, but I'm going to ask Elizabeth to go on to chat to respond directly to the other questions. So the last question I've got time for, it's from Julie, is why is the duration only 6 months? She has a patient who is schizophrenic and says he felt he could do with maintenance sessions, and he attends a long-term poetry group through Rethink, which he says is long-term, but he would like more. So the question is really around the 6 month.
Yes, I mean, that is on average, and I mean, it has taken longer for people throughout the lockdown period, but you know, people usually want to do 2 or 3 of those courses, and we really encourage, in terms of the longer term maintenance, it's those links that we're making through peer support with things that are going on in the community. So we recognise people need that ongoing support, but in terms of engaging actively with a programme, it's usually somewhere around the 6 month mark, but that is just a guide.
Lovely. Well, I'm going to leave you to the list of other questions there. Okay, Elizabeth, and I'm going to hand over now to Jonathan Foley and Amy Francis.
Thanks, Angela. My name is Jonathan Foley. I'm one of the clinical service leads with my colleague, Amy Francis, and our other colleague, Charlotte Winfield. And we're here to talk to you today about the iTalk service working across boundaries. Okay, so who are we? We are the Improving Access to Psychological Therapy service. We cover all of Hampshire, excluding Southampton City, Portsmouth City, and Aldershot Farnborough. These are provided by Steps to Wellbeing, Talking Change, and Talk Plus. We were commissioned in 2010. We work across the Hampshire CCGs, and we are delivered in partnership with Solent Mind. There are 3 core key areas to iTalk. iTalk Core, working with anxiety, depression, Axis 1 disorders, iTalk Health, working with long-term health conditions, and iTalk Work. We're a very busy service. We receive on average over 1,800 referrals a month, and we've been running for 10 years, and we are very proud to say that we've treated over 92,000 people in that time. What do we offer? We are a free evidence-based psychological treatment service for common mental health problems. We accept referrals for, and people can self-refer as long as you're over the age of 16, and we are an ageless service as long as the person is registered with a GP in one of our localities. In terms of psychological treatment, these are carried out either within a group forum, online, over the telephone, or one-to-one. And since from the pandemic, we mobilized the entire service to work online. Within 2 weeks, we remained open to referrals and continued our group and our individual treatment program on those platforms. Currently, we are offering some limited face-to-face appointments, and that's very much dependent upon clinical need. So what are common mental health problems? Well, the majority of our referrals are for people experiencing depression, but there may also be PTSD, body dysmorphia, OCD, social anxiety, health anxiety, panic disorder, and generalized anxiety disorder. Those conditions that we don't treat are schizophrenia, bipolar disorder, personality disorder, and eating disorders, or substance misuse. And in that case, we would manage that person's referral to the respective team, either the community mental health team, the eating disorder service, or signposting out to inclusion. We also work with long-term physical health conditions and understanding how that may impact on a person's mental health. iTalk work in line with the stepped care model, and this is an overview of the stepped care model as set out by the NICE guideline. And iTalk sit across steps 2 and steps 3, with steps 2 treating mild to moderate depression or anxiety, and that's with Solent Mind, and step 3 with Southern Health, working with moderate or severe depression. The CMHT will be at step 4, and inpatient unit services are at step 5, with the GP and practice nurse sitting at step 1 with that initial recognition of any mental health difficulties, the active monitoring and watchful waiting. This slide gives an overview of some of the treatments that can be directly booked on our website. They include psychoeducation groups, and I know that Amy mentioned in the chat about the carers group, computerized CBT, which is operated over the Silver Cloud platform, and we do have specific COVID modules within the Silver Cloud program. Face-to-face appointments, or more directly, it would be online appointments. We offer couples therapy for depression, guided self-help, or we may signpost out to another service, or indeed manage the referral on to either the CMHT or specialist services. So what psychological treatments do we offer? Well, predominantly our offer is for cognitive behavioral therapy, either at low intensity with Solent Mind or high intensity within step 3. But we do also offer interpersonal psychotherapy, which is a first-line treatment for depression, cognitive analytic therapy, couples therapy for depression, mindfulness-based cognitive therapy, which is a group-based program, EMDR, which is specific for treating trauma, and Comprehend, Cope and Connect, again, which is a group-based program for people who may experience chronic depression, compassion-focused therapy, focusing on people who've experienced trauma, and counselling for depression. I'm now going to hand over to my colleague, Amy Francis.
Thank you, Jonathan. I'm going to talk to you about iTalk Health, which is iTalk's long-term conditions pathway. iTalk Health was designed to address the reciprocal relationship between physical and mental health, as well as increasing awareness of the mind-body link within Hampshire. Historically, mental health and physical health services have operated separately, and the aim is really to integrate with physical health teams in line with the NHS long-term plan to ensure that we're treating patients holistically and trying to overcome barriers of access between services. Patients with long-term conditions have always had access to iTalk, and they can continue to access our core treatment offer. But by expanding our long-term conditions offer and working with physical health teams, we hope to remove barriers to engagement, because we recognise that patients with physical health conditions may not relate to the psychological impact of their condition initially. Within the long-term conditions pathway, we've made adaptations to things such as the language we use, making sure the physical health condition is at the centre of the intervention, and working with the physical health teams to help foster that engagement. As with all iTalk treatments, the interventions are evidence-based, with numerous studies showing the improvement on different physical health disorders, so such as diabetes and pain, when we work with the associated psychological aspects. Within the work with physical health teams, we also hope to share skills with different professionals through MDT working. On this next slide, we've outlined the key treatments included within the long-term conditions service offer. So I won't go through them all in detail, because as you can see, there's quite a few. But hopefully what you will notice is there are numerous interventions, which does allow for flexibility and patient choice. So in both our core and our long-term conditions pathway, a number of the options can be accessed immediately by patients, and they can be booked directly via the website. So things like our computerized CBT, our workshops, and our psychoeducation groups are all available now on the website. So I would encourage you to look there for further details. We are also, within our long-term conditions pathway, expanding our COVID offer. So all of the items that you see here are available during the current pandemic. They are being delivered online and remotely, but we are looking to add additional COVID-specific interventions moving forward. This next slide highlights really the consequences and the importance of maintaining access to a psychological therapy service within our community. The consequences being, if we have untreated depression and anxiety, it leads to poorer physical and mental health, and understandably then that's going to impact on many areas of our life, including our family and work. This slide is looking at the third strand within the iTalk service, which is iTalk at Work. And this is looking at the reciprocal relationship between mental and physical health on our job, our employment. So our employment advisors work directly with patients and link with employers to create awareness of how mental health can impact on people within the workplace. Another work stream within this within iTalk at Work are the modules and workshops that we deliver within workplaces to support people to manage stress. So the aim is really to increase awareness and equip people with skills they can use to stay well at work. The work our employment advisors do is incredibly important, and I think especially relevant in the current climate, and something we hope to continue to expand moving forwards. The previous slides have given you an overview of the numerous services offered within iTalk, but this slide also highlights how we work in partnership with a number of organisations within Hampshire to support local people. And this is something that we seek to continue to develop. We're currently in the process of employing outreach workers to support us to increase access for underrepresented groups within our communities. We collect feedback from our patients, and this slide really just highlights some of the words most commonly used to describe patients' experience of iTalk. So that's the end of our talk today. Hopefully we've got some time for questions, but I've just added our contact details, and I'd also just like to direct you towards our website and also our social media pages, which are useful to follow for further information of upcoming treatments.
Lovely, thank you very much indeed. That was you did really well to cram a lot of information, so well done, thank you. Right, I'm just gonna have a little look now. We've got Tim. Tim, is your question for Jonathan and Amy, Tim? I'm just seeing a comment here.
No, I don't think so.
Okay, that's
Angela,
fine.
I think he was just trying to respond to others.
Okay, yep, there's a whole thread. I'm just going through. Okay, so wait time for the service.
Can I cover that one off, Angela? Wait times for service?
Is there a wait time for the service? Just asking us, she's sure that there's been an increase in the past few months.
Well, interestingly, actually, there was a significant reduction in referrals at the start of the pandemic, and we're now about 25% down on the same 3-month period last year. Wait time, in terms of you can book from the website and start treatment almost immediately over Silver Cloud. You can book into webinars and group programs, and there is some assessment slots that are available on the website. It depends on really how we progress your referral and what you need as to then subsequent waits. But we one of our key performance indicators is to see all people by 126 days. So that's about four months from the point of referral.
Brilliant, thank you. And Beth, just before that, I saw Beth says, who is the person the referral is talking to, and what training do they have, please?
Yes, so we are the practitioners are trained within step 2 as psychological wellbeing practitioners, and that's postgraduate training. At step 3, a majority of our staff will have a core profession, either as a mental health nurse, social worker, or occupational therapist, or they will have been a psychological wellbeing practitioner previously, and they then take postgraduate training in cognitive behavioural therapy, which will then lead to accreditation with the British Association of Behavioural Cognitive Psychotherapy. So there's quite strict governance in terms of the qualifications that the staff require.
Thank you. You also have a list of questions, but I've got time for one more, which is from Heidi. And a simple question: do you currently have a long waiting list for iTalk services?
Again, I think it's in terms of what that person may require. We've worked really hard to reduce our waits over the pandemic, because all services have moved to online. So we predominantly offer a video platform which has enabled people from wherever they are in Hampshire to access some treatment rather than having to travel for that. Again, we would aim to see all referrals within 126 days, but there may be some caveats around that person's presentation, that they need to be seen at a specific time, or they have specific needs.
Thank you. Okay. Amy, and what I'm going to ask both of you, Amy and Jonathan, is to have a look at the last few questions. Yep. While I hand over to my colleague, Jason Hope.
Hello, everybody. Some of you may know me from my role in West Hampshire as a commissioner there for mental health services and learning disability services. In this space, I'm the programme management lead for the transformation programme for community mental health services across Hampshire and Isle of Wight. So I'm delighted for the opportunity, fairly near the start of this programme, to come and let you know a bit about it. It's a really significant programme which will take place over 3 years. We'll be investing in more staff, possibly another 300 or 400 more staff by the time we get to the end of the programme. And we'll be completely transforming the way that community services work. And it couldn't have come at a better time, really, with the surge that we're expecting from COVID, to kind of have that investment into new staff and new ways of working. So I just wanted to kind of give a bit of an outline about what this transformation programme is all about, and you'll see a little diagram. This came from the community mental health framework that NHS England published last year, and the programme revolves around implementing this particular programme, and certainly the vision of it had people at the centre of the service, and a whole range of support around them, which is not statutory service support, which helps people to maintain their health and well-being. And just a look at a couple of the bits, you'll see things like family and friends, work and colleagues, places of worship and faith groups. All of those have been impacted by COVID. So this layer around the outside will become under more and more pressure. So it's really important that we get this transformation right. So we're looking at integrating the delivery of community services between community mental health teams, our primary care networks, and voluntary sector organisations. We've made a start on that in some places, and it's working well. There'll be a wider team bringing together all public health services and making the opportunity for multidisciplinary discussion around support for people, making sure people can be stepped up and down support as and when they're needed, and in particular this will be an increase in the access to psychological therapies. You saw the stepped model earlier, so investing some more into some of those higher levels and making sure people don't fall between the gaps in the models. So we're doing all this with people with lived experience, with carers, and the range of people who work in mental health services. So that's why I'm particularly glad to be able to talk to it about this group who are perhaps not always directly involved, but will see people with a mental health need. A particular focus of those people with serious mental illness who experience a life expectancy that might be up to 15 or 20 years less than other people. And we want to make sure that in all aspects of mental health service delivery and performance management, that we integrate that and co-produce it. So just to give you a sort of a bit more detail of that outer layer, what we're expecting is that people will lead their own recoveries with support, that we improve the range of support for people. So when they want to access mental health services, they're not left with gaps, and they're not shifted between different services as each service says, it's not for me. So in this new way of working, services will come together and make sure that people are found the right support, whatever their need is. So the core offer is a team which is wrapped around the primary care network. It involves the voluntary sector, involves our community mental health teams, and finds people the right sort of support. So coming back to the opening title, No Wrong Door, certainly in the work that we've done at the moment, we've found that people are at their most anxious when they're facing choices about how they get support for mental health needs. And our service at the moment, it's fair to say, is fragmented and difficult to navigate through. So what we're very much hoping to do is to make sure that wherever people come from, that they get access to the support they need. However they approach services, they get access to the support they need. So in order to do that, we need to have better multidisciplinary decision making, better links between services. We're looking to dissolve some of the thresholds which lead to people being passed around services, and wrap the care around the individual so people are met with warmth and compassion, so that they're helped to lead their own recovery and they get the support they need when they need it. And to do that, we're also going to have to develop the staff. We'll need an education and career development program, including for people with lived experience, so peer support workers, to have a career structure through which they can develop into mental health services. So I said, for this programme, we are in the first phase. So we've done some high-level design. We are up against NHS England deadlines for accessing transformation funding. We've delivered a draft, and we're expecting to deliver a final version of our application on the 20th of January. Then we'll move on to a wider phase of engagement. Then NHS England and others is accepted. We can't do all the co-production we want in a few short weeks. And the service will be implemented probably from April of next year. So just to give you an idea of what's been involved so far, we've had 6 to 8 weeks of really significant involvement across Hampshire and Isle of Wight. We've answered around 15 questions. I think there's about 8,000 words or so. They're all high-level statements across a wide area, and we need to dig down into the detail of what some of that means. We've developed some of our financial thinking. 19 of the 42 PCNs across Hampshire and Isle of Wight have entered into the first year programme. Others will enter into the other programme in subsequent years. Portsmouth and Southampton, as cities, will develop their transformed services in an incremental way across the 3 years. Outside the cities, we're looking at developing within a PCN in an in-depth way. With all of the PCNs, though, we need to continue to return to them and make sure that they have enough resource to meet the need that there is locally. So there will be changes to the programme along the way. Oh, can we just wind back a tiny little bit?
Have I jumped? That's fine, sorry.
That's all right.
Oh yeah, sorry.
No, that's okay. I just want to give you an idea of how the programme works. So there is a transformation board which has an overview of the programme that reports to our mental health board across Hampshire and Isle of Wight. So with a number of work streams to our programme: finance, commissioning, development, information governance and information systems are really important, developing our detailed model and developing our workforce. Throughout all of those, we want to make sure co-production and health inequalities for people with serious mental illness are addressed, and there'll be a kind of a separate chunk of work around implementing in each locality. Also, we'll be looking at some of those areas which iTalk don't cover: personality disorder, eating disorder, and we'll need a model for younger people and older people, and to link with our rehab program, which is another of the Hampshire and Isle of Wight programs. So in summary, we're developing the program. We're going to make sure that people, wherever they present services, get the right sort of support. We'll need to grow our staff significantly to be able to do that, and also train and educate them and develop our peer support workforce. Thank you.
Thank you very much indeed. So I'm just going to have a little look at the first question that we've got coming for you. And again, what I might need you to do, Jason, I'll ask you a couple of questions, but if you can keep an eye, that's great. We've got a question from Anna. Any suggestions how to manage patients that are not suitable for CMHT, who have already been through the iTalk variations and are still suffering? We're holding these patients long-term as a social prescriber.
So very much this service is focused on those individuals as well. So what we have at the moment is a whole group of services with thresholds that will say, well, it's not for us, there's nothing we can do. So we're going to move to a new model where services come together and say, we need to support this individual somehow. How do we do it? How do we work between us so the individual gets the support they need? So that is the challenge of our transformation. And if we're truly successful, that issue will go away.
Okay, that's brilliant. And you've got comments there from Natasha along the same line, and again from Lara. So I'll leave those with you. The second question is, how can we feed into this, and how can we feed into this as we all have examples of people we support where there is a gap in the service? So again, it's threading that one back to you, Jason.
Yep. So phase 2 of the programme is some wider engagement. We've linked with people who are most involved with mental health services at the moment: our voluntary sector, our statutory services, local authorities, and others, but in order to meet some very tight timescales. But phase 2, between now and April, will be coming out much wider for engagement. So very happy for people to email me, and I'll make sure that anybody who wants to get involved can get involved in the engagement work that we do between now and April.
Brilliant, thank you. Well, you've certainly got some interest there. I'll leave that to you because I'm now going to hand over to Mike Newman, please.
So thank you, everyone. And I just wanted to spend the last few moments just drawing your attention to a number of the wellbeing resources that we've been putting together, building on the earlier versions of the work that we did with the local resilient forums, both in the voluntary sector group and the welfare recovery group. So what I've done actually is just provide with you some short extracts of the slides. So I appreciate some of the writing and some of the detail may be a bit small in the slides, but just to let you know that what we'll do is liaise with Angela to make sure that a full copy of the guide will come out with the notes of the presentation. So the guides that we've developed really just try and provide an overview of the national and local support available to support people's mental health and well-being. And these can be used by either individuals within your organisations or actually as a resource to support the people that you're working with directly. So what you can see on the first page, for example, is just some digital information which kind of links around the 5 ways to well-being, to sites like Every Mind Matters, which is a very good national resource for hints and resources and tips, things like 1U with the focus on physical health, and some recommended apps that you can use. And we've also linked there with the coronavirus resource page on Connect to Support, which provides a more broader detail of some of the community services available. And as you can see, as you then go through the guide, then you get more details of additional support available. So for example, a discussion around GPs, how to access local IAP services and our wellbeing centres. And then we've also included details around how to access urgent help if you would need it. So as well as providing just that list of signposting and providing numbers as well, where people perhaps haven't always got access to the online services, we've also included a couple of sections. So here's one example of where we just provide some tips to how to look after your mental health and well-being. So people, again, don't necessarily have to rely on linking to the online digital resource. And in these links, you can see this based on the Every Mind Matters guidance, that it is links to additional details and additional information. So finally, so as well as alongside that, guys, what we've been doing as well is developing or pulling together the various mental health and wellbeing training that's available for people within the community. So here's some examples here. So you can see, for example, that we have Public Health England have got a psychological first aid training, which provides tips on how to support mental health and well-being for others. So that's around a 3-hour course, so 3 1-hour courses that you can do for free. We also do commission our Hampshire Mind providers to provide Connect 5, and that's available on Zoom. So people can access that program over 3 sessions to learn how to offer guided self-help and support in improving people's mental health and well-being. And then from a suicide prevention perspective, again, many people may be familiar with this already, but with the Zero Suicide Alliance course, which is a 10 to 20 minute introduction about how to approach someone who may be struggling. And then there's the longer course, which is available on Learning for Healthcare, so the HEE site of Education England site, which is a 60 to 90 minute free course around suicide prevention training.
Thank you very much indeed. That was a really good bite-sized summary of a valuable resource that is literally going to come hot from the press, and my colleague Lynn Dudman will circulate it for you. So I'm just going to see if we've got any messages for, let's have a little look. Okay, so we've got various comments. I think that was about the last one. I think we're okay, because really your talk was more about explaining. So you don't have any challenging questions at the moment, but that doesn't mean to say they're not going to pop up. So if I leave you, thank you very much, Mike. If I leave you to keep an eye on the chat, and as I'm mindful of the time, we're going to move on fairly quickly onto the last couple of slides. Thank you very much. Right, so this is the end of the formal webinar. There's just a few things that I would like to say. Firstly, thank you very much indeed to all our presenters. They all went through the practice with me, which was great, and the timing was perfect. So thank you very much indeed for the effort and time that you've put into today. To Lynn, who's quietly on the other side, who is the technical support for today's webinar. And most importantly, perhaps, is the audience, because we would all be talking to ourselves otherwise. And I have to say that we've broken all records today, and it just really shows how important this topic is, because we've had over 70 people join this webinar, which is huge. So well done. And I know we have people coming from the Isle of Wight, Hannah and other colleagues all over virtually to join us today. So that's brilliant, 71 attendees. There's lots of information that's gone into the chat, and what I didn't say at the beginning is there is a way, which I learned last week, of saving your own copy of chat. So if you're in the chat box, if you take your cursor to the bottom right hand corner, you will see 3 dots. And if you wanted to save your own version of the comments and discussion that have taken place today, you'll have an option to save that directly. So please, if you want to save the chat before we finish, please do so. Sorry if you hadn't had time for me to ask your question, but do please either email the presenter, or I'm hoping that some of the questions were answered during the chat conversations. Do feedback via chat, or later on to Lynn by email if you've got any feedback about today. Thank you for the social prescribing webinar theme ideas that we've had today. I know Abby sent some through last time. We're going to be looking at a theme for the whole of the coming year. So please continue to share those ideas, either today via chat or via email to Lynn Dudman, please. As you know, during the COVID-19 period, we've set up a newsletter to help you keep informed when we don't meet every quarter. So what we've done, Lynn and I will be pulling together the next newsletter, and your deadlines, which sounds a long way in advance, is Friday the 22nd of January. That doesn't mean you have to rush in on that day. It means between now and the 22nd of January. If you have items that you'd like Lynn to coordinate and pull into that newsletter, please email her direct. As I said at the beginning, the webinar, the PowerPoint and other documents, they will all go onto the Community First and GVA websites. And before I move on to the last slide, there is also another thank you. And I don't think my colleague Nikki Staveley is here today, but for those of you that joined Nikki and myself in Eastleigh a few years ago now, Nikki Staveley is the Chief Officer of Gosport Voluntary Action, and she retires later this month. And she's been a stalwart support with Tim Houghton, Lynn and myself on the planning and the direction of travel for this network. And it's her starting it, and then Tim and Community First coming on board and really helping us to take it forward on behalf of the Hampshire CVS network. So I'd like to say a personal thank you to Nikki on behalf of all of us for her contribution, and also to wish her a very happy and healthy retirement. So, as promised, we now have the dates for the 3rd of March. So we've got the next date is the 3rd of March. We have 1 to 2 p.m. on Wednesday the 3rd. As you can see, we've got a theme now. We're on Wednesdays. So we then have 16th of June, 15th of September and 8th of December. So those are dates for your diaries. Don't worry, this webinar is going to be saved and the dates will be circulated as well. The PowerPoint will be saved so you can dip back in. It just really needs me to say to all of you, I'm wishing you a happy and a healthy lockdown Christmas and a happy and healthy New Year. Thank you very much for joining us. You're now free to go. Thank you.